given at MCG. Every single new building that is built, every single renovation that goes on at the Medical College of Georgia has at least one patient who serves on that committee. And the vice president for this area does not allow any plans to go forward that are not signed off on by a patient advisor. I was the patient advisor on the steering committee for the new cancer clinic, which is coming up out of the ground as we speak, and hopefully will be open this time next year. And I was in it from the ground up. I helped to hire the architect and all of the other managers. We looked at the way the building would be designed, how it would be set up, and then as we got to the point that we were looking at colors and furniture, we invited many other patients to come in as well and to give their input on the things that would make this a patient and family-centered facility as well as a patient and family-centered care facility. And we also serve on many committees, and I think now almost every committee in the hospital. I serve on the Safety and Joint Commission Committee, where each month I get the same reports that every doctor, pharmacist, nursing manager gets, showing where there may have been errors made during the past month, and then what they're going to do about it. And I've actually been asked by some of the people on that committee, has it lessened my belief in MCG and the quality of the care that is offered here, because I see these reports that show where there are some errors and, of course, areas that still need to be developed. And my answer is no, that as a patient, we know that you're human and that you're going to make errors, but we're delighted to see that you're working so hard at trying to keep those errors from occurring. And many times we can make suggestions that, again, just from the patient perspective, someone else might not have thought of. So what do? We speak locally. I've mentioned that we speak here at MCG. We speak regionally at different conferences. I was just representing MCG at a meeting with the VA hospitals in the Atlanta area. We speak nationally at conferences, telling our experience, telling our story, and then about the care that we have received here at MCG. You might wonder if this costs a lot of money. Well, it really doesn't cost that much money, because many times the suggestions that we make are ones that simply help the process that's already going on at the hospital. One in particular is selecting beds for the hospital. MCG in the last couple of years replaced the beds in a huge hospital, and they had a furniture fair and brought in lots of beds. The staff ran them up and down the hall. They put them in the elevators. They took them into the labs to make sure they fit. They made sure all the buttons worked, that all the lines matched up with the holes in the wall where they had different things they had to hook the bed into. And then it dawned on them they hadn't asked any patients. So very quickly they sent out an email and asked a bunch of patients if they would come down to this furniture fair. And when they got there, there were a whole bunch of vice presidents and nurses and nurse managers standing around to answer their questions and to show them what these beds did and so forth and so on. Well, you may see where we're headed. The patients did something totally different. The patients got in the bed. They wanted to see how the bed fit, how it fit them. Was it a comfortable bed? And from there, the hospital actually made, I think, a much better decision using input from the patients that truly cost them nothing. And in fact, the bed that was finally selected was one that has a control where the patient can control the lights in the room. Again, something that didn't cost any extra, but certainly gave a benefit to the patients. Again, we've already mentioned facilities design. We have an opportunity to help other families that are in recovery. One of the beautiful things that happens in the pediatric unit is that when a mother takes her child to the operating room, there's another mother who goes with her and then stays with that mother while her child is in surgery. And it's just a chance for that mother whose child has already received excellent care to help another mother whose child is now going through that care. We've already mentioned the medication protocols, patient family amenities. This is one that's dear to my heart. much of my treatment here at MCG involved radiation, and it was very intense radiation therapy. It lasted, in most cases, for 4 days. I came out of the operating room and was put flat on my back in a room in isolation for 4 days. And one of the things when I came and was asked to serve at MCG to be on a committee, I wanted to give back to this particular area. I saw one of the nurses the other day where they had a new patient coming in, and many of the little things that we suggested, for example, some Dentyne chewing gum because you can't get up and brush your teeth, some handy wipes that are already pre-wet so that you can wash your own face and your hands because you can't get up and take a shower or do any of the things like that for yourself. And also, just to help pass the time, they had a whole stack of Reader's Digest there, just small things that the patient could use to pass the time. We've also worked very hard through the physician's practice group to refigure and to restructure the bill that comes from the physician. We wanted the patient bill to look like a Discover credit card statement or your Visa statement. And it took us about 6 months of talking with everyone from the computer company to the legal department and so forth, where we would make suggestions and they'd go back and look at them to see if they could do it and come back and say, well, what if we did this? But we now have a patient bill that went out in January that the patients redesigned. And then we also participate in research projects. We have a project going on right now in which patient advisors actually go in during rounds with one particular team of residents, and they are observing the rounds and then completing a checklist on the patient and family-centered core values of respect and dignity, collaboration, and so forth. So what's in it for us, and what do we really want the most? Well, over and over you will hear us say we want communication. Communication between the patient and family and the doctor, the nurses, the pharmacist, whomever. But it's also listening to one another. It's talking, but it's listening, and it's being able to collaborate with one another. We hope that the hospital will continue to take these PFCC values and to embed them more and more and more into every single aspect of what goes on in the hospital. And then, of course, that continuous improvement. I'm an old educator, I mentioned, and we've always said that we'll probably never get education 100% right for every student every day. Well, the goal for PFCC at MCG is to try to have these values in every situation that a patient encounters every single day. And it's a continuous journey. And what we're doing is working together to make it better.
Okay. Thank you so much, Nettie. I think the audience can see, you know, what a tremendous partner we have in Nettie. But guess what? Nettie has our 249 other patient advisors in our system that are actively involved throughout our big system and have been growing this group of people since 1993. So you can see that we have collaboration going on across all of our inpatient and outpatient areas in the support and ancillary services, and even in finance, and you've heard a lot about the bill. You know, we all know how difficult hospital bills are. Well, this time we are getting so many wonderful comments and feedback on this new bill, which was basically designed by our patients with our physicians. So a lot of important work has gone on. Now, what do you need in the few minutes remaining? What do you need to have in place to make patient and family-centered care a reality in your organization? Well, one thing you need is a home for patient advisors. In our organization, we have a young man by the name of Bernard Roberson.